I'm going to quickly overview the physiology of the male reproductive systems, okay? So remember, so whenever we talk about this, okay, we talk about this hypothalamus anterior testis axis, right? Hypothalamus, that secretes the gonadotropin releasing hormones. That's going to go and work on the cells, okay, with a GQ pathway, resulting into, okay, synthesis and secretions of FSH and LH, okay, follicular stimulating hormones and LH. FSH has a receptors on the Satori cells, and LH has a receptor in the lytic cells, okay, because LH works on the lytic cells to make androgens, okay, and FSH works on this Satori cells to make all these proteins, okay, which is androgen binding proteins, and inhibin B, also growth factors, and also the Satori cells is very, very important for making these bridges, which is called cytoplasmic bridges, because that creates a blood testis barrier. Because as I said, the blood cannot have a direct contact with the cells that has to do with the production of sperm, because if that happens, immune reaction can occur, and then there will be a disturbance of the productions of sperm, okay? We talked about that. And remember, this Satori cell, they produce inhibin. This inhibin B is a negative feedback for the regulations of your FSH. It is a negative feedback for the anterior pituitary. The testosterone is a negative feedback for the productions of your LH, okay? Now remember, this testosterone can get concentrated with the androgen binding protein, okay? It bounds with the androgen binding and it gets concentrated. And that is important to remember for the sperm productions, okay? To maintain the sperm here, all right? And also, here I talked about the different paths that lead into production of the sperm. Remember, this is a seminiferous tubule. In the seminiferous tubules, okay, there's a cells which are called spermatogonia, okay, that get differentiated into primary spermocytes through the mitosis process. Then after the meiosis occur, okay, then they'll get differentiated into spermatids, okay. This process from the primary to spermatids, we call the process spermatocytogenesis, right? From the spermatids, what is going to happen? That's going to go to the Golgi, right? They're going to get cap, acrosome. They're going to also have those, enzymes like hyaluronic enzymes, okay? They will also accumulate all that, is that, remember, because of hyaluronic enzymes or other substances like jonah lysine, they required for the capacitation to occur in female, right? For the fertilization to occur, okay? For the fertilization to happen. So, the mature form of the sperm, we call them a spermatozoa, okay? And this, what is going to happen? The process, the sperm gets released from the blood testis barriers, okay, from the Satori cells and get into the lumen. The process called spermiations, okay? That we talked about. And then we also talked about this, the testosterone that get produced in here in the lytic cells, that has a lot of function in the brain. It does a libido. Too much, it can have aggressive behavior. It is also testosterone very, very important for the differentiation of the secondary sexual characteristic like epididymis, vas deferens, also this seminal-vesicles, right? And then this testosterone level, they can work on the red blood cells for the erythropoiesis, okay? They can also work on the larynx, to the growth of larynx, so you can have dipping in the voice. These guys also work on the skin, okay? So that way you can have pubic hair, okay? Or the axillary hair, that has to be the testosterone level, all right? They work on the muscle for the growth of the muscles and connective tissues, also a growth of your bone and the connective tissues. Okay, that's what happens. Remember one more thing, the testosterone, okay, that gets stopped releasing, okay, stop making at the 5 months of your fetal life, okay? Testosterone does not get produced after that. It does not get produced after until you hit the puberty, okay? So there will be no testosterone productions from the 5th month of life till you hit the puberty, all right? And then the growth of the beard also happens with the level of dihydrotestosterone. And this dihydrotestosterone, we're talking about this one, right? This enzyme called 5-alpha reductase that's in the peripheral tissues, okay, that use the cofactors with NADPH because it is reducing reactions and make this very more active than testosterone. And this dihydrotestosterone, what does it do? It does a differentiation of penis, scrotums, and growth of prostate. Okay, that's what it does in the early phase, right? In the late phase, the bald patterns, okay, the male, usually male later is, they go bald, okay? the male hair patterns or the baldness, okay, the growth of prostate, that's all had been done by this dihydrotestosterone, all right?